It's a man's job to respect a woman, but it's a woman's job to give him something to respect. That woman should show something which is to be respected. It is not mere that a woman is respected just because of woman. So one should have something that is being praised and respected. Now, coming to the diagnosis of the measles, it is just divided into different parts. The first is clinical and the blood test, typical signs and symptoms with history of the contact and one of the three C's and 4D also include that 4 days fever. So three C's, cough, coryza, conjunctivitis, and also sometime a P, the photophobia, that is also being considered. These are the classical sign and symptom give you the clue that it is measles. Observation of the coplic spots in the mouth is also diagnostic. There is decreased TLC with relative lymphocytosis as with other viral diseases. Now, the number two is the demonstration of the virus antigen. A simple diagnostic test demonstration of the multinucleated joint cells in the Gimza stain smear that is called Zank smear from specimens taken from nasal secretion, urine, and the skin biopsies. The measles virus antigen is detected by immune fluorescence also. So here one can see the coplic spots in the mouth which are diagnostic, then Zank smear in which one do see the multinucleated giant cell, and this is immunofluorescence of the virus that can be detected in the early stage. Now, third is virus isolation. It can be had from the nose, throat, conjunctiva, urine, and the blood during prodromal phase and up to 2 days after the appearance of the rash. Primary human or monkey kidney and the amnion cells are used for the culture of virus. One can see the cytopathic changes which appear 7 to 10 days later after inoculation. Earlier diagnosis of the virus is possible by immune fluorescence. Typical cytopathic effects, multinucleated giant cells containing both intranuclear and intracytoplasmic inclusion bodies are seen as an early diagnostic feature that suggests the presence of the measles virus. So here one can see the inoculation of the amniotic cavity, then inoculation of the embryo, and inoculation of the chorioalentine membrane, inoculation of the yolk sac, and that is the suitable culture for the measles virus. And also the certain Zank smear from throat and nasal swab and the symptoms classical 3C's and 4D's and the blood test, the serological test are also giving the clue of measles virus. Now, the serological diagnosis or serological test detecting the measles specific IgM antibodies in first or single specimen of serum is confirmatory. There is a rising titer of IgG antibodies measured by the serum enzyme linked immunosorbent assay or ELISA. Then heme agglutination inhibition test and neutralization test are also helpful. A fourfold rise in the titer is diagnostic. High titer measles antibody in CSF is diagnosis of subacute sclerosing pan encephalitis. Saliva specimens sometimes can be tested for salivary measles specific IgA testing instead of the serum, for presence of IgM antibodies. If the blood is not available, one can use the saliva to detect the measles specific IgA antibody. So here one can go for antigen detection or antibody detection. In case of the antigen detection, there is an enzyme link computing antigen and antigen to be detected, that is just here, and the antibody is attached to the spotting layer, and one can just detect the antigen by this way and method. Now, antibody detection, there is enzyme linked antibody against IgG and antibody to be detected here, and we have got the antigen attached to the spotting layer, which is capable of attracting the antibodies. And here the antigen to be detected is going to be attached, being attracted by the antibody which is attached to the. So we have got the known antibody to have the unknown antigen, and here we have the known antigen to detect the unknown antibody. So this is very simple procedure for the antigen detection and antibody detection. Now, serological diagnosis is not ideal in case of saliva, as the saliva contains other proteins and it contains 800 times fewer antibodies of measles than the blood sample do have. Extremely high IgG antibody levels without IgM in serum and cerebrospinal fluid is seen in subacute sclerosing panencephalitis and also atypical measles syndrome, that is the just diagnostic test that very high IgG antibody levels without IgM in the serum. Now, the fifth test is molecular diagnosis. It is the detection of the measles virus and RNA from throat, nasal, or the urine specimen by using reverse transcription polymerase chain reaction assay, that is abbreviated as RT-PCR. Method is useful to confirm cases when IgM antibody results are not so conclusive, so we have to go for the RT-PCR. Now, the differential diagnosis of measles, that means the other possible condition that can result in these symptoms like measles. These include meningococcemia, but here there is no cough, and conjunctivitis. Dengue fever, it has got the classical rash. Kawasaki disease, there is no cough, and there is also neutrophilia. And scarlet fever, there is the diffuse rash. Mumps, it have got the involvement of the salivary glands. Rubella fever, less striking as in case of the measles. Drug fever, urticaria, there is history of the drug intake which has caused this drug reaction. Then ecovirus, Coxsackie virus, and adenovirus, infectious mononucleosis, roseola infantum. The fever disappears. When the fever disappears in this condition, the rash appears. So these are the 10 differential diagnoses of measles. Here one can see the meningococcal rash, and that can be confirmed by the glass test. Then there is the Kawasaki disease. Here there is a type of vasculitis which is predominantly seen in children under 5 years. Kawasaki disease is a clinical diagnosis as there is no specific diagnostic test to have it, and one can see the rash on the different parts of the body. Now the scarlet fever, these are pustules and is the diffuse rash. Rubella, German measles, it is different from the true measles, and one can have the typical rubella rash here, and here there is a mumps, involvement of the salivary glands, and Then infectious mononucleosis, that is also give the different hives, the urticaria and the drug rash. These are having the different pattern. Then roseola infantum, that is the fever disappear and the rash appear after that. It is not associated with the fever. Now, coming to the treatment, once a person has become infected, no specific treatment is available, but the supportive care may improve the outcomes. Oral rehydration solution (ORS), healthy food, and control fever with the medicines. Antibiotics are used for the secondary bacterial infections like in ear infection or the pneumonia. Vitamin A supplement is helpful and it acts as an immunomodulator that boosts the immunity, antibody responses to the measles, and it decreases the risk of the serious complication like blindness. So vitamin A supplement is always helpful. Now, vitamin A, 2 doses, 200,000 international unit, does not prevent or cure disease. Then, no specific antiviral treatment if the measles develops. Fast-acting medication to dilate airways for the cough and to ease out the breathing. Avoid the aspirin to avoid development of the Rey syndrome. Zinc supplementation and the Chinese medicinal herbs have some role. Death occurs 10% in people with malnutrition. Mostly children less than 5 years old do die. And here is the God creation. No man can make like this, as the God has given this beauty to this beautiful peacock. And it's really wonderful to see when the peacock just have his or her feathers like that. It's really beauty to see. Now, what is the prevention of the measles? It is by the measles vaccine, safe and often in the combination with the other vaccine. The pure single measles vaccine is available, but with other combination is also available. Vaccination cause 80% decrease in the deaths. Mothers who are immune to the measles pass antibodies to their children in the uterus, especially if the mother acquired immunity through infection rather than vaccination. Means if the mother have been infected once by measles in her life, that have got the immunity, and that immunity that is longer lasting, and these antibodies the mother do give to the his or her children, to the newborn infant. Mother acquired immunity through infection rather than vaccination. Such antibodies will give immunity to the newborn infants against measles, but maximum for the first 9 months of life. So it is mandatory to give the measles vaccine at 9 months to avoid the disease. Now, it is not the mother antibodies to protect the kid from that measles disease. After that, infants are susceptible to measles, being after 9 months. So prevention is done by the active or the passive immunization. Now, coming to the active immunization, it is done by the vaccine available, that is available as measles vaccine alone or MMR vaccine and MMRV vaccine. It gives long-lasting protection. Vaccine-induced antibody developed in 94% of the seronegative recipients, and contraindications are pregnancy, acute illness, immune deficiency, and the active TB. A live attenuated intranasal aerosol vaccine has been developed now for the young babies also. It gives protection irrespective of the presence of the maternal antibodies which the mother has acquired during her infection of measles in her life. After 1 dose of the MMR, vaccine protection is 95%, and after two doses, it is 99%. Now, the active immunization by the measles vaccine alone, or it is the MMR vaccine for that. And here, that is intranasal measles vaccine, which is going to be available soon for the babies, and that is a part of active immunization. Now, it is done at 12 months as part of the three-part MMR vaccine, measles, mumps, and rubella vaccine. A second dose is given at 4 and 5 years later. Adverse reaction to the vaccination are rare with fever and the pain at injection site, so it is very safe. Life-threatening adverse reaction occurs in 0.0001%. That is very, very rare. In developing countries where measles is common, two doses of the vaccine being given at 6 and 9 months of age. MMR vaccine prevents measles after exposure to the virus, that is post-exposure prophylaxis. Now, passive immunization is for post-exposure prophylaxis against measles by an intramuscular injection of antibodies, measles immunoglobulin, or the normal immunoglobulin, NHIG is used. It's effective up to 7th day after the exposure to the measles virus and the person harboring the measles virus. Given in children with immune deficiency, pregnant women, cancer patients, infants less than 1 year of age, and the others, those who are at risk. Risk of the measles infection is reduced by 83%, and the risk of the death is reduced by 76%. Now, here is the passive immunization, and one can have the measles IgG antibodies here, and here there is a normal immunoglobulin which contains the human immunoglobulin G. These can be used, or this is the specific IgG immunoglobulin is being used. Now, the vaccine to the child, if HIV infected, is less effective, but early treatment with the antiretroviral drugs can increase its effectiveness if given to HIV infected child. All adult international travelers should receive two doses of MMR vaccine before traveling to that area where the measles is prevailing. There are false claims association between the measles vaccine and the autism. Measles infection protects against cancer. These claims have not been proved yet. There is no evidence that the measles vaccine virus can be transmitted to the other person. Now, the prognosis, most people survive measles. In some cases, complication may occur. Pneumonia is most fatal in 56 to 86% of the measles-related deaths. Other fatal complications are rhingotracheobronchitis, sensory neural hearing loss, and panencephalitis. Acute measles encephalitis is a serious risk, begins with very high fever, severe headache, convulsions, and altered mentation, and a person becomes comatose and dies because of the brain injury. The measles virus deplete previously acquired immune memory by killing cells that make antibodies and weaken the immune system, which can cause the death from the other diseases. So that is the end of the lecture, and hope you may have liked this lecture. If you have liked this lecture, please subscribe my channel and like the lecture, and also share it with others. If you have any question or the query, please don't hesitate to talk to me. And thank you very much for watching and taking interest. Thank you.